Hey guys, this session is a session on the skin and burns. Quick little bit of a recap about the skin itself as an organ, and then we're going to have a bit of a chat about burns, okay? So the integumentary system, or the skin, is known as a system. So it's actually the largest organ. It's not really considered by most of us as an organ, but it's actually the largest organ of the body. Consists of the skin, the accessory structures such as hairs, nails, endocrine and exocrine glands like sweat glands. The largest system of the body, 16% of the body's weight, and a surface area 1.5 to 2 square meters if you stretch yourself out. Okay. So what's the main functions of the skin? So what are the functions of the skin if you think about it? So protection, I suppose, is the first one. So it keeps pathogens and nasties out. It's their first line of defense. What else? Temperature regulation, so it's an organ that enables us to thermoregulate. It's a sensory organ. It's part of our nervous system, so it allows us to touch, allows us to feel a number of sensations as well. It allows us to feel pain, pressure. What else does it do? It synthesizes vitamins as well in the sun, doesn't it? So first line of defense against bacteria, virus, etc., and it's a barrier against mechanical stretches. Yeah. It helps us maintain temperature. Blood vessels dilate and constrict to control blood flow, which again evaporates on the skin to allow us to cool down. Fluid barrier, it helps maintain homeostasis. It keeps the bits on the inside in, doesn't it? It helps expel waste, so it's actually an organ of excretion. Small amounts through sweat, salt, urea, aromatic substances, and sensory. So sensory receptors, light touch, heavy touch, vibration, pain. The nociceptors allow us to feel pain. It synthesizes vitamin D in the sun, and it helps us absorb fat-soluble vitamins and some medications. So it has numerous functions, doesn't it? With a couple of different layers as well, guys, yeah? So let's have a look at them maybe. So we have the epidermis, epi being outside, dermis being skin, the dermis itself, and then the hypodermis, or subcutaneous layer. So the epidermis itself, the outer layer of your skin is actually dead. It's no blood supply, it's actually dead, and it's constantly flaking off. This is the part that actually offers the protection to us. There's a number of little structures in here. The business end of stuff actually rises from deep inside, from inside the dermis. So the blood vessels you can see, the roots of the hairs and stuff come in from the dermis, and in the subcutaneous or fatty layer you can see the blood vessels, which are deep down in the actual meat itself. So the epidermis, normally 0.5 mm to 1.5 millimeters thick, consists of stratified epithelial cells. There's no blood vessels, no nerves or sensory bodies, multiple layers or multiple stratas. It's stratified epithelium is what it's known as. The outside layers are already dead. So this is the outer layer for ourselves. The dermis itself is the thick layer under the epidermis. This is the business end where all the majority of the living structures are. So it's tough and elastic, very vascular. It contains sweat glands, sebaceous glands, lymph vessels, hair follicles, nerve endings, connective tissue, and adipose tissue is basically the fatty layer on the bottom. Okay. Subcutaneous or hypodermis, it's not really considered a layer of the skin. It's more a layer that sits on the bone, if you want. Basement layer of fatty tissue, which sits on the underlying bone, anchors the tissue above. So it's like an anchor that surrounds the bone, where the dermis is actually anchored and the epidermis sits on top of. Functions as an insulator and protective cushion. It contains nerve receptors and a lot of blood vessels. Okay, so there's more going on in your skin than what you think. And here's a nice little flicker of it. It's your basement layer, hypodermis or subcutaneous layer, your dermis itself with a hair follicle, number of sebaceous and sweat glands and stuff, and then we have the epidermis on top. Using skin in our surveys, which we do, so we look at skin colour and temperature, don't we? So colour, pale, normal, flush, cyanos, capillary refill, rashes. Yeah. So it's a good indicator, a good clinical indicator to us of what's going on with the patient, isn't it? It's a pretty good indicator of perfusion, because if the skin itself is pale or pasty or cyanos, we know there's no perfusion and the patient is shut down. Yeah. Temperature, cold, wet, warm or hot. Moisture, dry, normal or clammy. Skin disorders, some viral infections, so human papillomavirus, warts, verrucae, herpes, Chickenpox, shingles, these are all like various viral infections, and they manifest. Common stuff in kiddies with the likes of chickenpox, which again can re-manifest themselves in adulthood as shingles, yeah, and it's a viral infection. Fungal infections like ringworm, Taenia pedis, thrush, all very, very common. Stuff you get in swimming pools would be like verrucas, you know, all very common. Parasitic infections, scabies, lice and bedbugs. Scabies in particular, they tend to make their appearance in hot weather. Excuse me, very common in hot summers. And again, you know, rashes indicate the presence of these infections. Cellulitis, an infection within the skin itself. You can see if you were to touch that, it would be really hot. And the reason for it is we have a lot of vasodilation going on there, bringing white cells to the area to try and kill this infection. It's an infection in the skin itself. Impetigo, cellulitis and boils, all these are all infections in the actual skin itself. Quite a significant amount of fluid there. Not so much swelling, the swelling is from fluid, from vasodilation. Oh, excuse me. Burns are diffuse soft tissue injuries caused by destructive energy transfer. It's actually a traumatic injury. A burn is a traumatic injury. Normally, thermal energy has been bestowed on the actual flesh itself, and it cooks. Severity of the injury depending on the body surface area. So how much has been burnt? If it's only a small bit, it's not as bad. If I've got a large portion of my body, you know, burnt, it's obviously much more problematic. How deep did the burn go? So is it just the epidermis that's burnt? Like a bit of like sunburn? You know, is it down into the dermis itself, or is it a full thickness burn down into the basement layer where I'm burnt basically all the way down as far as the bone? So how much and how deep? Yeah. The greater the energy transfer, the deeper the burn. Yep. And also the longer you're exposed to the energy transfer, the deeper the burn. It depends on how much and how long. Okay. The longer the exposure time, the deeper the burn. Yep. So burn assessment. So superficial or first degree, it used to be called. They're called superficial. So just an involvement of the epidermis, a bit of pain, a bit of redness. It lasts a day or two. So a bit of mild sunburn would be typically your epidermal burns. Not a big deal. It's not anything that we worry about. A little bit sore, lasts for a day or two, and it kind of heals itself. Your partial thickness or second degree, we call partial thickness. This is when we have a burn through the epidermis down into the actual dermis itself. Pain, redness, swelling and blistering are always common. Injury can last, you know, 6-7 weeks. Scarring may occur. And again, we've got a destruction of a lot of structures down in the dermis itself. So, you know, we can have damage and injury to hair follicles, to blood vessels, to a lot of nerves. So, you know, pretty nasty injuries, very, very painful. Our full thickness burns is destruction of the epidermis and the dermis. It's a burn all the way down into this hypodermis or the basement layer. Surface is dry, waxy, charred. It's basically, the meat is being roasted. It's been burned all the way down to the bone. Tends to be kind of painless because the actual nerve endings themselves are actually destroyed as well as everything else. You know, on recovery, no regeneration of glands or hair follicles. You know, these kind of injuries, you're looking at skin grafts. You're looking at significant amounts of surgery to kind of take care of these injuries. And all of these injuries are very open to infection, which we need to be mindful of. So total body surface area, how much? Besides how deep, how much? So we use Wallace's rule of nines, you know, and in general, we have adult and pediatric gear given different kind of portions. So your head is given 9%. Each arm is given 9%. The front of your trunk is given 18%. The posterior of your trunk is given 18%. 1% goes to your genital area, and you get 9 or 18% for each leg. 9 on the top part and 9 on the bottom part. And if you add them up, they add to 100. Yeah, 36 and 36 is 72. You got your 18, your 27 for your head and your two arms, which is 99 and 1% for the genital area. When we talk about peds, it's a little bit different. So peds have disproportionately large heads. So instead of 9% for the whole head, they get 18%. The arms are 9 each and 18% front and back. The pelvis and legs are 14% each. So there's a bit of a change in distribution of body surface area with kiddies because of the disproportionately large head. Okay. So all of one arm burned, just the epidermis would be a 9% superficial burn. And that's how we would classify them. Greater than 10% adult or over 5% pediatric request ALS. So we have burns that are over 10% in an adult or over 5% in a child. We need to be contacting ALS. These patients most likely need fluids back into the system because the size of the body surface area is indicative of the severity of the burn as well as the depth. So what happens? Well, what does happen? What happens when you cook a Sunday roast or a chicken or something like that? You take it out of the oven and you sit it there. They call it to what's it called? To rest. By rest, it means actually the meat's still cooking. So you can take it out 20 minutes before you want to eat and you still have 20 minutes of cooking because the meat is still hot. So what we need to do is cool the burn itself, but not the person. In other words, we need to cool the burnt area. If it's all of this area, I can cool this area, but I need to keep the rest of the area kind of warm. Because once we lose the infrastructure of the skin, our internal heat can escape very, very quickly. Okay. So what happens? We get some pain, we get swelling due to fluid shifts. And remember, fluids can move in and out of blood vessels and they can move between body compartments. Cells are destroyed during the energy transfer. As we get burnt, the cells are being destroyed. May cause airway compromise if superheated gases are ingested. And you can think about that. So, on your knees at head height, in a compartment fire like a bedroom or something that's going really well, fire gases are actually burning at about 600 degrees at the height of your head on your knees. At the ceiling can be burning anything up to 1200 degrees if it's a fully involved fire. You take one breath of that, not only are you thinking about the actual thermal injury because that's going to go down your airways, which is then going to get burnt and going to swell. Think about the contents of what was in that room in a gas form. Some common fire gases would be the likes of cyanide, hydrogen cyanide. Everything basically that's in the room just turns into a gas form and you're ingesting it. But the heat of that going down your bronchial tree will actually burn it, which invariably will lead to swelling. So a patient who's been breathing super hot gases in a fire is most likely going to lose their airway. Hands may swell, so again, removing jewelry is important. Think about how much swelling happens. If it's big swelling, then everything past the swelling may not have a blood supply, and we can have the start of tissue necrosis. Okay. Considerations: hypoperfusion, absolutely, due to fluid loss. Heat loss due to loss of skin integrity, yeah, so we can lose the skin. If the skin gets burnt, all the heat inside can just run out. It's almost like opening one of those huge, massive wide doors in your kitchen. It's like opening everything and all the heat just rushes out. So hypothermia is a consideration. Potential for infections because the skin as a protective function is now gone. So all the pathogens can get in, all these bacteria and viruses can get inside. Special indications for if you look at the CPG, there's some areas which are particularly problematic. FHFFP, face, hands, feet, flexion points in the perineal area. So your face is a problem. If your face gets burnt, what's the issue with that? One of the issues is if your face is burnt, you may be ingesting hot fire gases at the same time. So burnt face equals potentially burnt airway. That's what I'm thinking about. Your hands, we do everything with our hands. So they're very difficult to actually heal. Look at the movement that's in these. Any movement at all is going to prevent this tissue from healing. Your feet, we walk around on our feet, so it means no movement. Think about the potential or how difficult it is for that tissue to actually heal. Flexion points, areas that bend. Anywhere that bends is going to be a problem because unless you're completely immobile, which is just not possible, it's going to be very difficult for this tissue to heal. The perineum is basically downstairs in your genital area. It's always a nasty place to get burnt. Caution with the elderly, circumferential burns and electrical burns. Always the elderly or the very young. Circumferential burns are full burns all the way around. So a burn all the way around an arm can inhibit circulation. A burn all the way around a trunk, all the way around a chest or an abdomen can prevent you expanding your chest. And this can cause potential death as well. Electrical burns, big problem. If I was burnt on my hand, that energy now ran all the way down here and through my trunk because energy always runs to earth. So we can have massive internal injuries that we don't see with electrical burns. And the other thing also, of course, is to make sure that the energy is off before we touch the patient. Yeah. Types of burns, so thermal burns. These are hot burns from flame scalds and cryogenic burns. Again, we mentioned cryogenic burns earlier with the likes on one of your other lessons on environmental emergencies with regards to liquid nitrogen burns. They do these actually, I suppose, in a positive way. If you're getting warts and stuff removed in the doctors, they put a little cap over the wart itself, and they simply spray liquid nitrogen basically into the hole. And what it does is it actually cryogenically burns off these warts. That's what it does. Electrical burns: caution with scene safety and prepare for cardiac arrest. Not only do you have huge internal burns, it will also disrupt the electrical activity of the heart and can induce cardiac arrest. So we need to be mindful of potential cardiac arrest. Chemical burns: solids, liquids and gases. Chemical comes in the states of matter. States of matter: solid, liquid and gas. So if we get solids on us, get powder on us, we need to brush it off. It needs to be lots and lots of water to irrigate it. Liquids, again, we need to irrigate them off. Gases, if we're in a gaseous environment, we don't need to be there. The likes of ammonia and stuff, you should be in SCBA, self-contained breathing apparatus. If you're in an environment like that, it will not support life. Radiation, yeah, okay. Friction. So these are all different kinds of burns you can get, okay. Friction burns: you come off a motorcycle and you don't have leathers on, you're going to have friction burns to the point that your skin is ripped off. So ensure scene safety when you're treating burns. Remove the source of the burn. Cool the burn, but not the patient. So cool the area of burn, but globally the patient's body temperature needs to stay between kind of 36 and 38. Okay. Cool the burn, not the patient. A, B, C, D, E. Scene safety. Secondary survey, sample history, get a set of vital signs. Yeah. What else do we need to do? If the skin has been broken, we need to cover the burn. We need to cover the injury because it's now an open entry point for pathogens, viruses, for bacteria. Okay. We need to maintain body temperature. What else do we need to do? Cool for a minimum of 10 minutes. Consider nebulizer with sterile water. Yeah, so you can actually give them a nebulizer mask with some sterile water in it, because what it'll do, it will humidify the airway, the airway breathing tract, and stop it drying out. In the case of chemical burns, wear appropriate PPE, brush off excess powder and remove clothing. Irrigate using emergency irrigation showers and be mindful of the potential of hypothermia. So people standing in these emergency irrigation showers in industry, you pull the string and there's probably about 200 or 300 litres come down through a shower area to wash all this stuff off. Okay, it helps keep you cool as well. Okay, so remove clothing and jewellery. Absolutely get clothing off, but just if it's chemical stuff, be mindful not to get it on yourself. If it's a thermal burn, you need to get access to the area to assess it and to treat it. Dress the injury because we're open to infection. Consider advanced life support. Absolutely, always. This is a traumatic injury, particularly in the elderly, particularly in pediatrics. Yeah, large body surface area burns, over 10% in an adult, over 5% in a child. You want to be asking for ALS. Consider mass injury. So you need to expose. We need to cut clothing off. We need to see where these injuries are. Consider the potential for decompensation. If we've lost a lot of fluid with big body surface area burns, we can have catastrophic drops in blood pressure and the patient can go into cardiac arrest. Some of the tools: water is a big one. Yep, water is always good. Burns dressing, burns gels, cooling people down for a minimum of 10 minutes and putting cling film on. Have a look at the CPGs. We'll have a look practically. Nebulizers, again, if we're putting sterile saline water into a nebulizer, it's just keeping the airway tract nice and moist and stopping it drying out. There's a CPG for burns in traumas. Burn CPGs, a lot of stuff in there, guys. Cool a burn for a minimum of 10 minutes. Areas of interest which are difficult to heal: face, hands, feet, flexion points in the perineal area. There's a ton of stuff in here. Have a look at this CPG, okay? You need to have a look at this. Pediatric ones is the same. Pediatric burns, again, it discusses different, the likes of total body surface areas over 5% that we need to be asking for ALS. These are where all the questions come from, guys, okay? You need to have a look at both of them CPGs, both adult and pediatrics. There's a little bit in burns. There's a few potential questions in it, but practically we're going to do some practice in the classroom. Okay, thanks, guys.